The Preschool Language Assessment Instrument 2 or PLAI-2 is a diagnostic tool for children aged 3 years through to 5 years 11 months that has been norm reference on English-speaking US children. It utilizes a picture book with full-color images to help keep children engaged and motivate them to complete its task. The PLAI-2 can demonstrate how efficiently a child integrates their cognitive, linguistic, and pragmatic abilities while communicating with parents, peers, teachers, or childcare workers in the preschool setting. The PLAI-2 has 6 principal uses. First, to identify a child's level of preschool discourse compared to their peers. Second, to assess a child's strengths and weaknesses in response to various language contexts. Third, to document the progress in their language development during and following therapy. Fourth, to assess whether there are variations between the child's expressive and receptive language skills. Fifth, to appraise receptive skills in children who are poor at using expressive language. And sixth, to evaluate a child's language skills for research. A key feature of this assessment is being able to determine if a child has difficulties with receptive language, expressive language, or a combination of both. This is very important when assessing children who have been previously diagnosed with other disorders, such as autism spectrum disorders, aphasia, deafness, or other developmental disorders.
The PLAI-2 can be used as both a language battery assessment and a screening tool to comprehensively assess language in the areas of content, form, and use. To be eligible for testing, children must be able to speak English, understand directions, and formulate necessary responses. The materials for PLAI-2 include an examiner manual, a full-colour picture book, and a record booklet. All of the PLAI-2 subtests must be completed in full. It is individually administered and takes approximately 30 minutes to complete. The PLAI-2 consists of 2 types of assessments: a norm-referenced formal assessment and a non-standardized informal assessment. The norm-referenced assessment is comprised of 6 subtests. The first 4 subtests assess different concepts of language. These are matching. This evaluates a child's skills in naming objects and identifying common objects. Selective analysis. This assesses the child's responses to questions about characteristics of objects. Reordering. This assesses the child's responses to questions that require information over and above important features of objects. And reasoning. This evaluates the child's ability to predict and reason what could or would happen to an object under certain conditions. The remaining 2 subtests, receptive mode and expressive mode, assess modes of response, being nonverbal and verbal responses. The non-standardized assessment of the PLAI-2 is useful for investigating a child's pragmatic language behaviors and features 2 measures. The first is adequacy of the response. This evaluates the child's expressive language according to 4 categories: fully adequate, acceptable, ambiguous, or inadequate. And the second is interfering behaviors. This examines the child's interfering behaviors that hinder interaction. These are classified as under-responsive, for example, a whispered response, and over-responsive, for example, using excessive language. These analyses are delivered as a follow-up to the PLAI-2 subtests and give the assessor further evidence that will supplement the understanding of the child's performance and aid in composing a therapy plan.
Test administration. There are a number of components to consider when administering the test. First, the test should be performed in a quiet room, and no other children should be present during the testing. The caregiver may be present if need be, but they are advised not to assist the child in answering any questions. Ideally, the child should be seated at a table in a child-size appropriate chair with their feet on the floor and directly facing the clinician. The picture book should be set up as a foldable easel on the table, as this allows the child to easily see the pictures and allows the clinician to follow the prompts on the opposite side. The clinician should only repeat the question if the child indicates that they haven't heard correctly. The following video demonstrates a speech-language pathologist administering the matching subtest to a child. Matching is the lowest level of the 4 levels of language abstraction. The matching subtest assesses both expressive and receptive language skills. There are 9 questions that test the child's expressive skills, where the child is asked to name the objects in the pictures. And there are 8 questions that test their receptive skills, where the child is required to point to objects when the name is given to them.
What is this called? That's a cup. What's the lady doing? She's putting the cup in her nose. Oh look, it's a cat! Meow. Show me the clock.
Scoring. There are 2 record booklets, an orange one used for children aged 3 years and a green one used for children aged 4 to 5 years. There are 74 items in the PLAI-2 where each item assesses one of 6 different subtests. This forms the standardised portion of the test. Scoring for standardised measures. The child's answers to each question in the subtests are either marked correct using a 1 or incorrect using a 0 in the booklet. A total raw score for each subtest is calculated, then converted to age-equivalent standardised scaled scores, which are available in Appendix A of the testing manual. Finally, the scaled scores for the expressive and receptive subtests form an overall discourse ability score. This measures a child's overall competence in the preschool discourse and is the best estimate of their ability to produce and understand verbal communication. If a child's scores are below the age equivalent norms, it is recommended that the child undertakes further testing. Scoring for non-standardised measures. 2 optional non-standardised measures of behaviour can also be recorded and scored to assess 2 important pragmatic aspects of a child's communication: adequacy of response and selected interfering behaviours. They are recorded by marking a check mark into the appropriate box on the record booklet, then are summed.
Strengths of the PLAI-2. The PLAI-2 provides a variety of information regarding children's preschool discourse. It is comprehensive in measuring both expressive and receptive communication in the 4 different levels of language abstraction. Secondly, the PLAI-2 provides relevant information specifically directed at assessing communication in a preschool setting. This is particularly relevant to parents and preschool staff who are interested in observing a child's strengths, weaknesses, and progress in their day-to-day schooling environment. The administration process of the PLAI-2 is organised well and is easy to follow. Administration instructions are presented on the flipbook on the side visible to the examiner. The standing flipbook enables children to have a clear view of each picture while also leaving the examiner's hands available to make notes in the scoring booklet. Limitations. The PLAI-2 assessment does have some limitations. As it was developed in the United States, the scores are normed against a sample of American children and may not reflect the norms of Australian children. The PLAI-2 is also only available in flipbook form, which may restrict application as the child must remain in their seat. However, this is because the test is used to assess the child's ability to engage in a formal classroom environment.